For many communities across America, the turn of the decade with the advent of COVID-19 has seen increased pressures on all aspects of life. Depression, drug use, and violence have all risen since 2020. We visited an organization in Brantford to see how they use a comprehensive approach to behavioral health in order to offer support to those in the community who are affected by these issues.
BHcare is a certified community behavioral health center, and we're also the local mental health authority, or LMHA, for the Brantford and Shoreline area, and also the Ansonia and Valley area. We provide mental health services as well as services for people with substance use disorders. That includes our wraparound services, case management, vocational, social, rehab, as well as housing, and we also offer children's services.
In the post-pandemic world, the pressure of day-to-day life has seen an increase in behavioural health issues. For Sarah Magistro at BHcare, the new normal has led to an increase in some old issues.
Unfortunately, during the pandemic and the isolation that it caused for a lot of people, as well as the added stress, the anxiety about being home, getting sick, all of these things really caused a significant increase in depression and anxiety, among other things.
For Rachel Shapani, one of the issues that was brought up by the pandemic was an increase in domestic violence.
The pandemic really forced people to stay inside their homes, so that community support, they didn't really have as much access to it, and so we did see numbers rise during that time.
Domestic violence is an issue that can affect anyone of any age. For Rachel, its prevalence makes it important to let people know that there are resources available to help.
We see it in all age groups, from teens up till older adults. And so that's why it's really important to get this information out to all different demographics.
It's an issue that Rachel says can be helped by more awareness, especially within families and communities.
So the reality is that if it's a friend, a family member, or a coworker, you might not be seeing it, but that doesn't mean it's not happening. And so by communities just being educated about what the resources are, by what the signs are, things like that, that information can be out there for the people that need it.
The past few years has also seen a rise in drug use disorders and mental health crises. For Sarah, the need for programs that address these issues is greater than ever.
There has been a very significant increase in opiate use disorders as well as overdoses nationwide, but Connecticut hasn't been spared for that. So we really want to be available and offer as much support as people need as they work on their recovery.
For Sarah, the fact that society is talking more openly about the issues is a positive step.
One thing that did come out of the pandemic was an increased discussion about mental health. That definitely, we did see that increase, and people were talking about it, which was a good thing because it drew attention to it, and it's kind of normalized it. Like, it's okay to talk to a therapist. It's okay to talk to a psychiatrist. It's okay to be on medication. Those things are all okay. They're not taboo. They're not things that we should keep secret anymore.
Education is a vital part of the process of addressing behavioural health issues. Rachel Shapani believes that reaching out to young people is one of the most important steps in increasing awareness of the problem.
One really important piece, from my perspective at least, is getting this education and prevention into schools, into younger groups, because there is a level of talking about this issue with different age groups, and so making sure we're continuing to build on this information and knowledge and carrying it through our young adults, and hopefully they'll take it with them through the rest of their lives.
Many people affected by mental health issues, drug addiction, or domestic violence situations say that they feel imprisoned by their circumstances. It can often feel like life has set a trap for them from which they cannot escape. But as St. Paul says in his second letter to the Corinthians, our inner self is being renewed day by day. Where there is empathy, perseverance, and support, there's always